medicine. To begin with, I would like to mention a few things about my deliberation today. I will present my deliberation in three phases. One phase goes to the mechanism of action of this venesection, then what is osteoarthrosis, what is venesection, and then a clinical study. Clinical study is evidence-based scientific study, controlled clinical design in the cases of application of venesection, that is letting out of blood from the veins. You have heard about this cupping. I would tell you that there are three types of bloodletting from the body according to Unani system of medicine. In Unani system of medicine, there is a knowledge of Islamic medicine, then Greek medicine, whatever was the best in Arab continent, and then Indian continent. So it's a combination of all these things. But Islamic medicine a little bit different from Unani medicine. We are concerned with the Unani medicine. I am a scientist working in the Center Council for Research in Unani medicine in Ministry of Health and Family Welfare, Government of India. So this is the brief introduction. The term osteoarthrosis has been derived from three Greek words. Osteum means bone, arthron means joint, and osis means condition of disease. Hence, the literal meaning of osteoarthrosis is the disease condition of bones and joints. Technically, osteoarthrosis is implied on osteoarthritis. The meaning of osteoarthrosis has been given as osteoarthritis in medical dictionaries, and the text also referred osteoarthritis as osteoarthrosis. Sometimes both terms are referred jointly as osteoarthritic disorder and degenerative joint disorders. It's a degenerative disease of the articular tissues characterized by joint pain, morning stiffness less than 30 minutes, swelling or effusion, joint instability, muscular weakness, and restriction of movement. Prominent signs are bony enlargement at affected joint, crepitus on motion, and malalignment or joint deformity. Galen, a well-known scientist of Unani system of medicine, Ibn Sina, the well-known scientist of Arab medicine, Razi, Majoosi, Akbar Arzani, the Indian physician, Azam Khan, also an Indian physician, and Kabiruddin too, recommend the application of venesection as an adjuvant therapy in the treatment of the cases of vajrul mafasil, that is arthritis. Osteoarthrosis as such has not been mentioned in Unani classics, but it is a kind of disease, vajrul mafasil, widely described in Unani classics. Moreover, recent studies carried out at University of Western Ontario, Canada, and Australian Gastroenterology Institute reveal the healing property of venesection in the cases of hemochromatosis, where arthritis with chondrocalcinosis was also present due to deposition of calcium pyrophosphate. Now, what is Fasd, that is letting out of blood through venesection? Venesection is a non-drug regimental intervention carried out on different veins as per the indication to eliminate out the putrefied or morbid humors. Venesection is a Latin word formed into two words. Vena means vein and sectio means cutting. It means surgical opening of a vein for withdrawal of blood. Fasd is an Arabic word, means evacuation of blood from vessel, the same meaning. According to Ibn Sina, venesection is a procedure by which the blood is eliminated out the human body by a lancet. On another place, it is stated that Fasd means to incise the vessel by lancet. Selection of elimination of morbid material might be in terms of particular organ as Saud and Utus for head, or particular khilte fasid as Fasd for general elimination of all the morbid material, whereas Sal, Qay and Idrar for selective materials. Galen, Razi, Majoosi, Akbar Arzani, Azam Khan Kabiruddin recommend the application of venesection in arthritis as adjuvant therapy. So this venesection basically works at the clear out the morbid material from the blood circulation as well as from the body itself, which leads, this morbid material leads to the imbalance of the temperament. Temperament is a basic concept of Unani medicine by which the disease is produced. If we correct the temperament, then health reassures. So what venesection does, venesection get rid of the morbid material from the circulation and the body as well. But how we will judge that this morbid material has been expelled out and the blood circulation becomes normalizes? This is the thing which has to be proved by scientific measures. For that, I have devised certain parameters by using the knowledge of hemorheology, a new emerging science in the field of hemodynamics and blood physiology. This is hemorheology. Hemorheology is a science which deals with the nature of the flow of the blood and the constant as well. So these are certain parameters on which we can carry out the studies to determine the effects of venesection or any other bloodletting, because in Unani system of medicine it is believed that there is morbid material in the blood, ghilzat in the blood. What is that morbid material and what is that ghilzat? That can be differentiated with these parameters before treatment and after treatment. So this is plasma viscosity, whole blood viscosity, red blood cell aggregation, red blood cell rigidity, flow of red blood cells, measurement of RBC aggregation, measurement of platelet aggregation, measurement of hematocrit value, biochemical parameters, fibrinogen, albumin, globulins and lipids also. We know that if there is very high shear rate of blood flow or very low shear rate of blood flow, in both of the conditions, what happens that RBCs clumps together and forms the Rolex. This Rolex formation is reversible and RBCs completely dispersed by shear stress physiologically, but sometimes pathological aggregates are due to an increase in concentration or adhesion potential of plasma proteins and qualitatively very different from physiological aggregate. These adhesions, this formation of adhesion on the surface, blood cell surface, is in terms of Unani medicine known as ghilzat blood or the putrefied matter in the blood circulation. So here you can see this is the physiological Rolex formation and second one is the pathological blood Rolex formation, which inhibits the normal flow of the blood. What we have to do with the venesection? We remove this stagnation, we remove these Rolex. So this is the thing behind this venesection application. So Rolex class linked end-to-end attachment is physiological and form a three-dimensional structural network. Size of Rolex inversely proportional to shear stress. In pathological condition, dense clumps formed by side-to-side attachment, discontinuous leaves plasma blouses devoid of cell. These pathological clumps are highly unstable, tending to increase in size even when shear stress remains constant. As a result of during constant but retarded flow, clumps become even larger. Hence, complete separation of cell and plasma occurs. These clumps also show a tendency to sediment. Rolex form only in the presence of certain macromolecules, for example, fibrinogen, microglobulin, and IgM. RBC's aggregation occurs due to adsorption of macromolecules to adjacent cell surface. So here you can see what happens when Rolex formation is there. If there is Rolex formation, do you have pointer? So there is stasis in blood flow. This stasis produces the Rolex formation, and due to Rolex formation, viscosity of the blood increases. Hence, resultingly, further stasis is there and slowing of blood flow is there. At the same time, this deprives the cell to take ATP and cell aggregation is there, and this vicious cycle comes together, and resultingly further stasis is there and accumulation of CO2 at capillary level is there, and resultingly blood pH decreases and acid environment takes place. So this lower the pH ultimately swell the RBC and it's become rigid. That we can assess with the help of hemorheological parameters, red cell rigidity. Then red cell rigidity increases slowing of blood flow again. Then hypoxia and acidosis increases, further increases in cell rigidity. This is also a vicious cycle. Ultimately what happens? Ultimately blood flow in the capillary is stopped and become very slow. Then what to do to increase the flow? To get rid out of this low pH, to get rid out of clumps, application of venesection at the site. So hemorrhagical therapy, I have told already this thing. So venesection is a kind of bloodletting which is being used prophylactically as well therapeutically. It is basically used to prevent certain forms of circulatory failure. Now, application of venesection in osteoarthrosis. Osteoarthrosis presents the main clinical manifestation as pain, morning stiffness of less than 30 minutes, muscular weakness, loss of movement, disability to perform ADL. Pain in joints is the chief agony which the patient experiences of movement. This interferes with ADLs and working output. It has been experienced that after therapeutic intervention of Fasd, the patient gets relief immediately. In view of the biophysical, biochemical dimensions of hemorrhagiology and the pathophysiology of osteoarthrosis, we can reach to certain points which help us to understand the mechanism of action of venesection in the cases of osteoarthrosis. As we are aware that the pathological changes in the cases of OA lead to subchondral bone remodeling, which results into subchondral irregular thickening with sclerosis and cyst formation. This is good evidence that the increasement in intraosseous pressure due to these changes in subchondral bone produces pain. Relief of this pressure, which is thought to result from obstruction of venous outflow, can relieve pain. The therapeutic intervention of Fasd releases this pressure and is helpful in relieving pain. Therapeutic intervention of Fasd clears out the pain-producing endogenous chemical stimuli, algogenic substances such as serotonin, substance P, bradykinin, prostaglandin, and histamine. Algogenic substances like kinins are found in plasma, histamine in granules of mast cell, in basophils and platelets. Serotonin is found in mast cell and platelets. Hence, the substances which are found in blood stream cleared out directly. Others may be affected indirectly by the application of Fasd. Due to stasis of blood flow, there is increased blood viscosity, decreasement of pH, Rolex formation, cell rigidity, lactic acid formation, and hypoxia. Application of Fasd enhances the local blood flow, removes the stasis, which help in normalizing the local pH, removes the cell rigidity, checks the Rolox formation and clears the already formed clumps, decreases the viscosity, removes the acidosis and hypoxia, hence it is helpful in relieving pain, stiffness and muscular weakness. Since it removes the condition of hypoxia, which is said to be an important contributory factor in production of OA, hence venesection may remove this state and might be helpful in delaying the destruction of articular cartilage. Moreover, oxygenation of the local tissues through this procedure may lead to healthy status of the joint structure for better performance. Since first intervention enhances the local oxygen supply of the articular tissue structure, hence it might be used to avoid local ischemia, which is a contributory factor in causation of OA. So we have designed a controlled study to carry out the effect of venesection in the cases of osteoarthritic cases. We have made two groups, one group only this venesection and the second one group with this conservative treatment and the second one group with venesection and the conservative treatment. So study objectives are to evaluate the efficacy of Fasd in the cases of osteoarthrosis, to increase mobility and work performance of the cases, to rehabilitate them in the society, to provide a safe and effective alternative therapy to relieve the existing signs and symptoms of the osteoarthritic cases and prevent the untoward effects of NSAIDs. Duration of the study was 1 year. Study design was open controlled study. Sample size total 43 cases were registered, 3 cases were dropped out. Therefore 40 cases, that is 20 cases each in group A, that is control group, and group B, trial group, completed the trial. Inclusion criteria was age between 35 to 65 years, sex both sexes, clinical and or radiographic evidence of osteoarthrosis, patient who was ready to sign the informed consent. Exclusion criteria was anemia, hemoglobin less than 10 mg, diabetics, pregnancy and lactation, patients having renal insufficiency, patient having liver diseases, patients having past history of blood disorders, other type of arthritis, patients having ISD and hypertension, any joint surgery in the previous 6 months. Criteria for selection of the subject: the patient were diagnosed and included in the study on the following parameters: joint pain, morning stiffness of less than 30 minutes, muscular weakness, joint swelling, effusion, restriction of movement, radiological presence of OA, change the joint. The subject having at least 4 out of 6 above mentioned features were selected for the study. Assessment of temperament was also done of the patient. This is the basic criteria for Unani medicine, to observe a particular temperament of a subject. So this is the photograph showing the photograph showing the pre-regimental procedure. Before going to the Fasd, we clean out the site with antiseptic lotions, shaving off the hairs, then tie a tourniquet on the returning site. In the case of that one, this tourniquet was applied on the thigh, and the popliteal vein was targeted to clear out the morbid material around the knee. So this is the application of venesection. Venesection is done by a very fine lancet. We put longitudinally and this piercing, just piercing, and after piercing the blood gets out for 10 to 15 ml at a time. After that automatically it stops. This is the natural phenomena. So this has been done in the case. So the schedule of venesection was at baseline, then 14th day, then 28th day of treatment. Control drug, the drug tablet is Ojai, prepared, manufactured by Hamdard Laboratories, Delhi, and the locally oil was applied, Rogan Surkh, a product of Hamdard Laboratory, Delhi. This is the composition of capsule Ajai. These are the drugs which have been included in this capsule, extract of the drugs. Dosage and mode of administration. In group A, capsule Ajai were given 2 BD after meals, and the Rogan Surkh and oil was applied on affected joint once at night daily. In group B, same drug and dosage was administered as group A with application of venesection on the indicated site, that is popliteal vein in the case. Duration of protocol therapy was 6 weeks. Concomitant medication, no any concomitant medication was given during the study period. GCP monitoring was there. Withdrawal criteria was failure to follow the protocol, dropouts due to either reasons, any adverse reaction to adverse event. However, no adverse reaction was reported during the protocol therapy. Informed consent was also taken according to the GCP module. After obtaining the informed consent, the positive cases of OA were randomly allocated to either group A or B. Each of them were given patient ID number. Group A, that is control group, was administered with the oral and local drug only, while group B, that is the test drug, was administered with venesection in addition to the same conservative method. Assessment of efficacy was done on clinical parameters, lab parameters, arthritic profile, radiological parameters also. Assessment of safety was also done. The clinical assessment was made for any untoward signs, symptoms, baseline and every follow-up, hematological assessment, TLC, DLC, SR, HB, biochemical assessment, LFTs, KFTs. Assessment period was baseline 14th day, 28th day and 42nd day. And the radiological assessment was made only at baseline and 42nd day. Evaluation of study result was done on found severity grades. Grades are here. I will not go into the details. Criteria for evaluation of safety was there. Statistics was applied here, Mann-Whitney test and Wilcoxon sign rank test. So here is the demographic data. You can see here the total cases were 40, 20 in each group, and 30. This is the age groups of the sample size. And this is the sex distribution of the sample size. This is the religion of the sample size. Then dietary habits. Here you can see the personal history, addictiveness, non-addictiveness, smokers, non-smokers. Then a distribution of the OA cases according to the family history. Distribution of OA cases according to occupation. Then economic status also. Then treatment history was also taken. Temperament was also assessed of the patient. There are 4 types of temperament in Unani system of medicine. The predominance of dam, that is dambi, predominance of phlegm, that is balgami, predominance of yellow bile, that is safravi, and predominance of black bile, that is Saudavi, that behaves according to the temperament. The patients were observed according to having these complaints. So here are right knee, left knee, and both knee. 3 type of cases were there. Here you can see the results. What happens? This blue line represents group A, while the this red line, this pink line represent this group B. So this pink line is that group which is having with venesection and conservative treatment both, while this blue line is dealt with only conservative treatment. So you can see here at baseline the application of venesection was done, and dramatically it was decreased on the very first follow-up on 14th day, the pain, but not in the group of conservative treatment. And simultaneously, at the end of the treatment, it was remained the same pattern. This result of the venesection is comparatively better in comparison to the conservative treatment. As in the case of morning stiffness also, you can see here there are better results in the group having the venesection. Same thing is muscular weakness. Swelling was also dealt with in the same fashion. Restriction of movement was very much improved in the group who was taking this venesection in addition to conservative treatment. Bar diagram showing the effect of walking time. In group A and group B, you can see the effect on walking time. It little bit better in the group which was having this venesection. There is no significant change, but there is a little bit difference. Hemoglobin level is better in group B, where in group A, where this venesection was applied. ESR was also improved. Bar showing KFTs. Here you can see the safety of the intervention on KFTs. Arthritic profile, uric acid and ESR. In both of the cases, you can say that after treatment, parameters becomes rectified. Summary and conclusion. The test intervention was found safe and well tolerated as evaluated on hematological parameters, LFTs and KFTs. Therefore, it might be concluded that test intervention is a safe and potent regimen for symptomatic relief of pain. It removes the morning stiffness and muscular weakness, subsides the swelling, effusion, and ultimately removes the restriction of movement of the joint. Through this regimen, the existing symptoms of OA might be relieved and disability might be prevented, which is the most common problem in increasingly adult population of the country. Thanks.
I have to say what I told you before, that we used to make this also in Chinese medicine, perhaps in another way. I didn't know about the conservative treatment. Perhaps you know that also in the stroke, it's indicated to lift the lung, the tongue, and to make a wound in the veins under the tongue for the stroke in traditional Chinese medicine. It's also venopuncturing treatment for bleeding. And in some cases, Chinese people said that they could reverse the stroke, treat the stroke symptoms. No, they use also up to that level. No, so I'm absolutely confident with it.
Oh, thank you very much. Actually, this is a clinical study on osteoarthrosis particularly, but this venesection has been applied in Unani medicine in various diseases and various disorders, hypertension, this stroke, and this tonsillitis, this pharyngitis, pneumonitis, and all these symptoms. So there is a need to carry out the clinical studies further for other diseases also.
Congratulations.